Hello, welcome to another Dr. Foot video. I have had another question about the toe lift procedure from a few patients and a few of my esteemed podiatry colleagues regarding the aftercare package that I provide to patients post toe lift procedure. Now, as part of the toe lift procedure, I give patients an extensive array of aftercare products that I want them to use, which include silicone gel products. I've been asked, do I provide skin lightening creams? And also, is there any evidence regarding the products that I do provide for hypertrophic scars? Well, the answers are I absolutely do not give patients skin lightening creams. I don't think they are ethical, but that's just my personal opinion. If somebody wants to give them out, that's up to them. But no, I do not give skin lightening creams. Regarding the evidence for the products that I do give as part of the aftercare package, I'm going to go through this in a little detail with you right now. So as I've said before, scars on the tops of toes can vary a great deal in quality depending on the individual and the racial background of that particular patient, the nature of the trauma caused by footwear and by the use of caustics and acids, and the type of wound healing that has occurred. They frequently determine the aesthetic impairment. All of these issues can affect how the aesthetics have been affected. They can be symptomatic, they can cause itching, tenderness, pain. They can also cause sleep disturbance, anxiety, depression. People can get disruption of daily activities. Other psychological effects include post-traumatic stress reactions, a loss of self-esteem, stigmatization leading to a diminished quality of life. Now, I provide a mixture of topical silicone gel as well as silicone sheeting. Topical self-drying silicone gel is a relatively recent treatment modality. A study found that patients with scars of different types, including superficial scars, hypertrophic scars, keloid scars, that were treated with a silicone gel application, they found that the results were satisfactory. Now, this started, I think it was the early 1980s, where silicone gel sheeting was widely used for hypertrophic scars and keloid scars. Since then, several clinical studies and reviews have confirmed its efficacy. The International Advisory Panel in 2001 suggested a combination of intralesional corticosteroid injections, which is what I do, and silicone gel sheeting for the treatment of hypertrophic scars. Silicone gel sheeting was first used, as I said before, in 1981, but it was used for hypertrophic scarring at an Australian pediatric hospital. There was another trial done by, I think, 42 people aged between 2 and 60 that had red or raised scars. The trial studied the effect of silicone gel treatment at 2 months and at 6 months, and compared it to people that have not had treated scars, so untreated scars. The results showed that 93% of scars improved and had improved after 2 months of use with the silicone gel products, which is great. Another study, probably one of the largest of its kind, and it involved 125 people, which is a lot of people, who had either red or raised scars that were up to 20 years old. So these scars were there for a long time. Now, this study proved that 81% of the patients who continued with the trial found that they had improvements to their scar, even if those scars were 20 years old. 81% of patients who continued on the trial improved their appearance with the use of silicone gel products. How do silicone gel products work? Well, silicone gel contains long chain silicone polymers. I think it's called polysiloxanes. I find it so hard to pronounce these words. Silicone dioxide and other components. Now, these long chain silicone polymers cross-link with silicone dioxide. It spreads quite ultra thin on the sheet, and it works for 24 hours per day. It is self-drying, and it dries within a couple of minutes, the cream itself. I also give silicone sheeting, which I'll talk about in a short while. The silicone gel exerts its actions in several different ways. Let me briefly explain how it does this. It increases hydration of the stratum corneum, thereby facilitating regulation of fibroblast production and reduction in collagen production, which is great for scar tissue. It results in softer and flatter scars. It protects the scar tissue from bacterial invasion also, and prevents bacterial induced excessive collagen production in the scar tissue. I'm going to get a little technical now, so bear with me. It also modulates the expression of growth factors, fibroblast growth factors, B, I think it's called FGFB. There's a tumor growth factor B, which is called TGFB. Now, TGFB stimulates fibroblasts to synthesize collagen and fibronectin. FGFB normalizes the collagen synthesis in an abnormal scar and increases the level of collagenase, which breaks down the excess collagen. Balance of the fibrogenesis and the fibrolysis is ultimately restored. I know that was quite heavy going, but it's important that you know what's happening to your skin. Now, silicone gel products, the cream and the sheeting, have been proved to be effective in reducing not only the symptoms such as itching and discomfort associated with some scars on the tops of toes, also they can help to reduce the thickness and the discoloration that you get from scarring on the tops of toes. Hope you found this video interesting. If you have any further questions regarding the toe lift procedure, please let me know. Thank you for listening. Bye.